Yeah, as you know, day by day the number of dengue cases have been increasing. As of now, even our hospitals, the KC General Hospital, we do come across the number of cases. The last 2 months statistics, if we see, number of fever cases has been increasing. Per se, dengue cases, almost 20 cases have been with the NS1 antigen positive. They have been reported, but confirmatory ELISA test still may not. But according to the symptoms and signs and symptoms, our doctors, they are treating on OPD basis as well as the IPD. So, to actually, if you see the outside, how it is this what is a grievance, what severity. Depending upon the severity, we don't find that severity in with the cases who are getting admitted in a hospital, because a number of cases they come and symptomatic dengue or dengue. Presumptive dengue. Those all cases have been treated on outpatient basis, and even surrounding, even the private hospital, if they do confirm with the NS1 antigen, the cases have been coming to us, and they're being treated with we categorize mild, moderate, and the severe. There most of the cases supposed to be in a mild cases. They are treated on OPD. Certainly, if the vitals are not stable or patient needs admission, depending upon our physician or the pediatrician suggestion, patients are admitting in a hospital and they're getting treated. And luckily, within 2-3 days, they're being treated. Hardly we come across some patients who are in need of platelet. So platelet transfusion, recently we transferred 2 patients. Within 24 hours, the platelet, everything has come up and the patients are stable. And accordingly, we have made some SOPs within our hospital. The patients, once they come to the OPD, we have made all the doctors, all fever cases, suspected dengue, they will send to next to the OPD only one more block. They will go to there and all the vitals will be checked once again. And accordingly, if the patient needs blood testing, even the laboratory also have been arranged with taking the blood samples. And if it confirmation with the RPD kit is confirmed, again we send to the instruction has given to send to the ELISA testing. So the ELISA testing, it is a confirmatory. So depending upon the severity of the patient, again next step will be mild and moderate. We categorize and we treat accordingly. And even the beds in the medicine ward and the pediatric ward, we arrange the beds also for the patients. So all the necessary medicines like the drug of choice would be paracetamol tablet that adequate we have accumulated, and paracetamol infusions, IV fluids, and even we have deputed our staff nurses, trained staff nurses, and even paramedical staff also they have been deputed for the ward purpose. And daily we are maintaining what is the status. At the end of the day, we do monitor how many cases have reported, how do we go about, and in timely whatever the instructions from the government of Karnataka Health Department, our Honorable Health Minister is addressing many of the SOPs, many guidelines have been coming. All those guidelines, we are following the guidelines.
So usually it happens in every monsoon. There will be fever, like viral fever, dengue related like illnesses. Usually they increase in surge of being rainy season in monsoon, especially in Bangalore. Because we should, every monsoon season we'll tell them to take care of your surroundings, like not to store rainy water either in the bucket or in the outside rubber tubes or on your terrace with the broken plastic pieces. You should keep your premises very clean, and should see that mosquitoes doesn't fly in the daytime around your houses, and you can inform your authorities to take care of the mosquito spray like fogging or larva killing, all those things. But in spite of that, sometimes usually some pediatric age group and young adults, they do come with history of fever, and we are well prepared to treat the fever cases, and we are making a fever screening also. So usually the dengue will come positive after 4th to 5th day, and before that we take a fever surveillance and we do screen them. If the patient's symptoms are serious, we'll admit them, we'll treat them, and definitely the dengue maybe is rise in Bangalore city, but inpatients as such there is not much rise in our hospital. We are treating them, and patients are getting treated safely and going home, and we are fully prepared for the treatment of dengue. And all the preparations we have done in our hospital setup, and we advise always in these cases precaution is better than the cure. Take care of surroundings, and follow the guidelines given by BBMP or health department so that you can prevent dengue in around your surroundings.
Any dengue patient or ICU?
No, we don't have any patient as of now today in ICU, but we do have around 11 patients in the adult group, both male and female, and about 16 patients in the pediatric group. And some are like, NS1 positive, not proven dengue. Among that, 3 to 4 patients, ELISA test has come positive, and they are all safe. They are doing well after treatment.
ಪ್ರತಿದಿನ ಎಷ್ಟು ದಾಖಲಾಗುತ್ತೆ ಪ್ರಕರಣಗಳು? ಎಷ್ಟು ದಿನ ಪ್ರತಿದಿನ ಎಷ್ಟು ಡೆಂಗು?
ಅಲ್ಲಲ್ಲ, ಫೀವರ್ ಕೇಸಸ್ ದೇ ಆರ್ ಕಮಿಂಗ್. ಫೀವರ್ ಕೇಸಸ್ ಬರ್ತಾ ಇದೆ ದಿನ. ನಮ್ಮ ಒ ಪಿ ಡಿಯಲ್ಲಿ ಒಂದು 30-40 ಕೇಸ್ ಇಟ್ಟು ಬರ್ತಾ ಇದ್ದಾರೆ. ಅವರೆಲ್ಲ ಕೆಲವರೆಲ್ಲ ಔಟ್ ಪೇಷಂಟ್ ಅಲ್ಲಿ ಮೈನರ್ ಸಿಂಪ್ಟಮ್ಸ್ ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೊಂಡು ಹೋಗ್ತಾ ಇದ್ದಾರೆ. ಕೆಲವರಿಗೆ ಬ್ಲಡ್ ಟೆಸ್ಟ್ ಆಗ್ತಾ ಇದೆ. ಸಿಂಪ್ಟಮ್ಸ್ ಸಿವಿಯರ್ ಅವರು ಅಡ್ಮಿಟ್ ಆಗ್ತಾ ಇದ್ದಾರೆ. ವಿತ್ ಇನ್ ಅ ವೀಕ್ ದೇ ಆರ್ ಗೆಟಿಂಗ್ ಡಿಸ್ಚಾರ್ಜ್ಡ್.